in gender dysphoria, a female to male transgender journey, which is being sufficed by hormone therapy, where an individual finds himself to be in congruence with the seeked gender, number one. Number two, assesses himself towards a planned surgical reconstruction in the genital surgery. Many individuals seek metoidioplasty. Metoidioplasty is a single stage surgical journey where we bring about a closure of the vagina, use the vaginal flap to create the urethra, but most important, give you a sensate organ from your own clitoris as a trans man. So all trans men who seek to have metoidioplasty are aware about a single stage surgery where metoidioplasty brings about the detachment of the clitoris from its attachment and therefore being hidden, comes up now as an erect organ. It becomes a shaft of the size anything between 4 to 7 centimeters. It has got all the sensations of a male organ, it being a clitoris, which is akin to a female shaft or penis. And once it's enlarged with the hormone therapy, which goes months after months, there's a good amount of blood supply trigger and a good amount of tissue that has got generated. Helps us as reconstructive urologists who are into the art of metoidioplasty to be able to bring about mini phallus to be created around with very good sensations which already existing in the organ, straightening it up completely and bringing about the closure of the vagina and creating a urethra. The creation of urethra many a times could also be from buccal mucosa, also be from the skin and from closure by Bayer's flaps. In doing so, you are able to, as a single stage surgery completed, able to go to a washroom and pass urine like a male. That means your desire to pass urine standing is completed, number one. Number two, you can stimulate your organ and your genital stimulus is as good as it is for any normal individual. Compared to a phalloplasty where the sensations could be different in different individuals and at different points of the phallus itself. So metoidioplasty being a single stage surgery is being sought more commonly now in a female to male gender reassignment where they're aware that they are not very keen for a penetrative coitus. A stimulation is good enough for them when they can stand and pass urine and they don't have the burden of carrying a very large organ, which requires a multi-stage surgery with its own changes and nuances, compared to the phalloplasty group of individuals who seek phalloplasty and undergo a multi-stage surgery in which we do a phalloplasty and then we do a urethroplasty. And then I go ahead to implant the processes, which is the Shah's processes, the single processes inside. I gather at this point in time, we also have got the smaller processes available for metoidioplasty, which is sought by some individuals who get a good hormone enlargement and whose shaft or penis can later on be implanted by this smaller implants which are available right now, and they probably could be able to be sexually penetrate too. So metoidioplasty is a very different concept altogether. It was designed as a single stage surgery for those individuals who did not really want to be active on a sexual coitus, but could be good enough for stimulation and masturbation. And their main aim was to come out of this very entrapment of the body that they are in and the organs that they are in. So these individuals undergo their mastectomy, they undergo their hysterectomy, oophorectomy, and their vagina is kept open till we do a metoidioplasty. In a metoidioplasty, which lasts anything between 4 to 5 hours, we bring about a creation of a vaginal flap, which will help us to create a proper urethra or the pars urethra, the urethra which is also the bulbar urethra in the male. Once we do that, we actually bring about a vaginal closure and completely close the vagina forever. Having done that, this urethra is created and then the Bayer's flaps are being raised. The clitoris is brought about out of its moorings, and as a result of which the clitoris actually stands tall. It is the straighter organ compared to the hidden and the curved organ deep inside. It is already enlarged as a result of its increased blood supply and tissue, and the entire organ enlarged as a result of hormone therapy that you're undergoing. It actually makes easy for us to then create an organ which could be anything between 4 to 7 centimeters. At the end of the surgery, when all the closures are completed and the urethra is created, we also leave testicular implants, and those implants are helpful for you to actually feel almost complete stage as a single stage surgery. So that implant are normally processes which are available and which are placed from the suprapubic region down to prevent any infection. So metoidioplasty group is increasing gradually, and that we at Kokilaben Hospital do metoidioplasty as a single stage surgery for individuals who seek female to male gender transition. It is important that the awareness does happen from this platform for individuals who have undergone a therapy and have done well, stable, and moved on in life with partnership with cisgender females, and probably moved on in life to much better understanding for themselves, and obviously come out of entrapment. It is important for Metoidiioplasty group to know that this is possible, this is being done, and this is being done with a lot of planning. Thank you so much.